Good afternoon. I'm Linda Pierce with the Town of Westport Board of Health. I'm the town nurse. I feel it's very highly important to have postpartum depression as the health subject this month after the recent tragedy of the mom who in Duxbury murdered her children. In Westport, there's an average of 85 births per year. 1 in every 7 women suffer postpartum depression, 14%. 11.5% reported started depression during pregnancy. 66.5% reported depression within 6 weeks after birth, early postpartum, and 22% reported onset after 6 weeks after childbirth. 1 woman reported postpartum depression after 26 weeks after childbirth. There is a postnatal depression scale called Edinburgh Scale with questions to focus on how severe the depression is to get the appropriate treatment. Women's Behavioral Medicine at Lifespan offer an 8-week course on mindful-based stress reduction to balance mind, body, and spirit. The goal is to help moms cope with the emotional challenges of transitioning to motherhood. Dr. Carmen Monzon is a postpartum specialist in psychiatry. Postpartum depression is not a mental illness. There's a crisis center that is in New Bedford, Fall River, and Plymouth. The number is 508-99-63154. There's different therapies, support groups, medications. There will be a new medication out in August by the company Biogen, and it's for postpartum depression. Self-care is very important, relaxation techniques. Treatments may last months or longer to include counseling, antidepressants, or hormone therapy. Postpartum depression often has treatments with psychotherapy, also called talk therapy or mental health counselor, or both, by a psychiatrist, a psychologist, or a mental health professional. The meds that people that are breastfeeding would take sertraline. Strategies for preventing postpartum depression is education, sleep and eating properly, exercise, avoid making life changes right after childbirth, let your feelings be known in the delivery room, enlist good supports during birthing. Prepare yourself for a well childbirth, enlist household help during the postpartum period. When does postpartum depression go away? You may worry something will happen to the baby or you're doing something wrong. It usually goes away within 2 to 3 months. How long is a mother considered postpartum depression? It begins upon the birth of the newborn and can last 6 to 8 months. The hormone that causes postpartum depression is estrogen and progesterone, can lead to increased sensitivity to stress, can cause being overwhelmed, fearful, or panicking. There's 3 phases of postpartum depression. Acute phase happens within the first 24 hours, immediately after delivery. Subacute phase can last 2 to 6 weeks after delivery, and late phase from 6 weeks to 6 months after delivery. Know what to expect according to your MD. Sleep as much as you can. Sleep deprivation can be a factor to postpartum depression. Eat plenty of clean proteins and healthy fats. Lean on your support system. Don't cut calories, especially if you're breastfeeding. Babies consume around 1,000 calories of what you've consumed. And practice patience. Postpartum depression is associated with our neurotransmitter balance, low serotonin or norepinephrine levels in the brain by nutritional deficits. It takes about 6 months after delivery to balance the hormones back to normal. Risk the dangers of postpartum depression. High risk is high life stress, lack of social support, current or past abuse, prenatal depression or marital or a partner dissatisfaction. Don't discard your feelings. If any of these symptoms have occurred to you or someone you know, they need to be seen as soon as possible for the welfare of their child as well as themselves. The Women's Behavioral Medicine number is 401-793-7020. There's a website that's also, you can call your obstetrician or your primary health care provider if you have any of these symptoms. Now, I still have Narcan kits available. If you or an associate has a problem with drugs, having a kit readily available may save your life. May 11th, down in the annex, is our next blood drive between 9 and 3, and flu shots are no longer being given. And if you were not able to get the phone numbers, you can please always call me at my office. I will get back to you as soon as possible. And for any advice or any phone numbers that you may need to get some help, and please call 508-636-1030, and I will get back to you as soon as possible.